Herbalism is the study or the practice of medicinal and therapeutic use of plants as a form of an alternative. Plant and plant extracts are used to have a more natural way to stimulate and restore the body. In the 18th century, there were many common herbs used to treat people.
Yellow fever was characterized by turning the eyes and skin yellow and causing black vomit from the internal stomach bleeding. We now know that it is caused by being bitten by infected mosquitoes, but in 1973 it was believed to be a miasmatic disease that was caused by rotting vegetable matter and other filth. Philadelphia in 1973 was home to the first major American yellow fever epidemic. The city was depopulated by the disease. 5,000 people died and 17,000 others evacuated. The epidemic in Philadelphia peaked during the first weeks of October. Yellow fever swept the city by surprise. Hospitals were not ready to treat the population. Benjamin Rush was very involved during the epidemic. He believed that rotting piles of coffee beans were the source of the disease. To treat yellow fever victims, Rush practiced bloodletting. It is now known that Caribbean refugees brought the fever to Philadelphia, and mosquitoes spread it by biting infected victims and then healthy ones. Bloodletting is the longest running tradition in medicine. It originated in ancient Greece and Egypt. It was used as treatment for every possible ailment, including pneumonia, fevers, back pain, rheumatism, headaches, melancholia, and even bone fractures and wounds. Despite being used to treat countless diseases, there was never any evidence that bloodletting helped. Bloodletting was based on a system of medicine where blood, phlegm, yellow bile, and black bile were humors, and where the proper balance of these humors maintained good health. If you were sick, it was thought that you had an imbalance in your humors, so bloodletting was done to restore the balance. Bloodletters would open a vein in the arm, leg, or neck using a small knife called a lancet. They would tie off the area with a tourniquet and cut diagonally across the vein and collect the blood in measuring bowls. Here is a passage from Watson and Condy's 1858 Practice of Physic book. The main object of general bloodletting is to diminish the whole quantity of blood in the system, and thus to lessen the force of the heart's action. The object of local bleeding is, in most instances, that of emptying the gorged and loaded capillaries of the inflamed part. Sometimes blood is thus taken directly from the turgid vessels themselves. More often, I fancy topical bloodletting produces its effect by diverting the flow of blood from the affected part and giving it a new direction, and so indirectly relieving the inflammatory congestion.
The Gross Clinic is a painting by Thomas Eakins that depicts Dr. Samuel Gross performing a surgery in front of a crowd of Jefferson medical students in the 19th century. Dr. Samuel D. Gross was one of America's top physicians and surgeons. The surgical amphitheater in the picture is located in the upper lecture room of the Jefferson Medical Hall. Thomas Eakins was a student of Dr. Gross and had attended that particular surgery. His painting shows Dr. Gross performing leg surgery on a young adult. The patient's mother is sitting on the left in tears while Dr. Gross lectures the surrounding students on the surgery he and his assistants are performing. At the time, the Gross Clinic painting was thought to be too grotesque for the general public. That has changed, though. Today, the work of art is held in high regards as an important 19th century medical painting.
Hit the beat and take it to the verse now. Yeah.